Raise your hand if you've ever seen someone with blisters and sores on the lips and they tell you, I have night fever, oh yeah, Bali. And then all of you now join together like a choir and say, yeah, it's malaria. You know me, I like spoiling the usual thing, those fluid-filled blisters on the lips, crusts, bleeding, oozing this kind of yellowish fluid. Those cold sores are neither caused by malaria nor a symptom of malaria. That person has herpes simplex virus or malaria anemia. That person has a viral infection. It is not malaria. Don't worry, I'll break it down in a way you and that person will understand. Now, herpes simplex virus is an STD, but it does not only affect the genitals. You can also get it through kissing, sharing your cups, your spoons. This is something that Ndi Igbo have an idea of what it is, but they just don't know that it is caused by a virus and more serious than they think. Amamnyu na-akpọ ya n'olu nke unu mana anyị nwa na-akpọ ya ngwakọ ọnụ. Ha sị gị na onwe ndị ha na mmadụ ji ofu ngajiri kọọ nri ma ọ were ofu kọpụ ṅụkọ mmiri ihu onye ebido bawa ha n'ọnụ. That is herpes simplex virus. When you get this virus, it stays in your nerves for life. You can only treat it to reduce the frequency and intensity, but you cannot cure it. It will just go and lie low. Many people you see, they have herpes simplex virus, but you won't know because they are not showing any symptom. All it takes is for something to come into your system, like an infection or sun exposure, stress, hormonal fluctuations during your menstrual cycle. These are the things that can wake up that virus. And one of the commonest ways it can show itself that it is in the system is cold sores. Now, the idea of malaria cosa. When you get the malaria parasite, it is not just going to attack your red blood cells and your liver. Your immune system will also be affected. So since your immune system is compromised, if you have the herpes simplex virus, it is bound to show itself. So you start having the cold sores on your lips, and these cold sores come with fever. Now, because it is happening when you're having malaria, they will now think that it is the malaria that brought it, but it already their body before the mosquito even see you bite you. Now, children can also have this herpes simplex virus. Don't kiss children on their mouth. Remember that you, the adult, your mouth is doing plenty things in the other room. Yes, you love sharing things with your child, which is very normal, but for the safety of that child, if it is a drink, let your child have his own cup. Pour for the child. That drink can remain and give the child. Stop them today. That bite and give. Okama, you break with your hand and give the child. Some mothers even go as far as chewing certain things like nuts for their babies and then transfer from their mouths to the baby. Why not crush and give? There are even mothers that do a very funny thing. When a child has something on their skin, they try to remove it and maybe it's dry. You see mothers, they will take their saliva. Why? Herpes simplex virus can spread very easily. You can touch your genitals and then put the same hand in your mouth. You start having oral herpes. Or a child who has already picked up that oral herpes and sucks the tongue. You see that child having herpes whitlow. If your hand is always in your mouth, absent-mindedly, you're also touching your eyes or your nose. By the time in a you have transferred from your mouth to your nose or to your eyes, and you start having an eye infection. Or that same hand, after everything, you're just scratching randomly on your skin. With time, you see eczema forming on that spot. When someone gets this virus for the first time, there's usually this sore throat, fever, headache, painful gums, or muscle aches, or even swelling around the throat. You'll be finding it difficult to swallow, sores on the tongue, not just on the lips. Some of these symptoms may no longer show with time whenever something reactivates that virus. For example, when you have malaria. From the first day, you will notice this tingling and itching and pain or even numbness on the lips. That is when the virus is still trying to secure a room inside your nerves. Within 24 hours, you will notice bumps forming. These bumps will start getting filled with fluid, blisters. It usually starts from the edges of the lips. These blisters will be red, painful, and swollen. By the second or third day, those blisters will rupture and then start oozing that yellowish or clear fluid. From the fourth day, the oozing will stop. These crusts will start forming on the lips. Within 2 weeks of getting this virus, you see the crust coming off, and then the sores will heal. And if you have malaria, when the cold sores now disappear, the malaria don't go with everything it came with. The malaria was only a trigger. If you get any other kind of disease condition, so long as that disease condition fights your immune system, the cold sores will come back. So you start taking anti-malarials without any proper tests, and then these cold sores will heal on their own, but you never still get yourself. This medicine what they do for person na just fake, chalk, you know they work anything, because no be malaria they do you now. You saw cold sores on your lips and you used it as a confirmatory test. Achuchu na malaria, don't they get night fever? So how can I prevent it? Run away from kissing any Tom, Dick and Harry. Do not share your utensils, even towels. Always wash your hands. And that woman, she know the green person touch her pikin. And she be the first way born. Go born your own now. If she tells you wash your hands, do so. Not when they show your bad character. Or at least use a hand sanitizer. Some of you will even go as far as for person pikin. Some of you in when you see your partner taking a certain medication that you do not know what it is, consult a medical practitioner to confirm, because it could be an antiviral for herpes simplex virus. Because if you see ask your partner, he go tell you it's a supplement. You're always having those blisters. Go to the hospital and get tested for herpes simplex virus and get antivirals. Bye bye yo.